Good morning students. Today we will see about the solved question paper of May 2018, that is of 2010 Physiology. The first question is define arterial pressure and give its normal value. What is high? Explain long-term regulation of high blood pressure. The blood pressure is the lateral pressure exerted by a contained column of blood on all of the arteries. This pressure exerted when the blood flows through the arteries. Normal blood pressure is 120 by 80 mm of mercury. Hypertension is defined as blood pressure above 140 by 90, and it is considered severe if the blood pressure is about 180 by 120. The long-term regulation of blood pressure, otherwise called as renal mechanism for regulation of blood pressure. Kidneys plays an important role in the regulation of arterial blood pressure. When the blood pressure alters slowly in several days or months or by years, the nervous mechanism adapts to the altered pressure and loses sensitivity for the changes. It cannot regulate the pressure anymore. In such conditions, the renal mechanism operates efficiently to regulate blood pressure. Therefore, it is called as the long-term regulation. The kidney regulate arterial blood pressure by two ways. First, by regulation of ECF volume and through the renin-angiotensin mechanism. First is by regulation of ECF volume. When the blood pressure increases, the kidney excretes large amount of water and salt, particularly sodium, by means of pressure diuresis and pressure natriuresis. Pressure diuresis is the excretion of large quantity of water in urine because of increased blood pressure. Because of diuresis and natriuresis, there is a decrease in ECF volume and blood volume, which in turn brings the arterial blood pressure back to the normal. When blood pressure decreases, the reabsorption of water from the renal tubules increases. This in turn increases the ECF volume, blood volume and cardiac output, resulting in restoration of blood pressure. Second is through the renin-angiotensin mechanism. When the blood pressure and ECF volume decreases, the renin secretion from the kidney is increased. It converts angiotensinogen into angiotensin 1. This is converted into angiotensin 2 by AC angiotensin converting enzyme. Angiotensin 2 acts on two ways to restore the blood pressure. First, it causes constriction of arterioles in the body so that the peripheral resistance increases and blood pressure rises. In addition, angiotensin 2 causes constriction of afferent arterioles in kidney so that glomerular filtration reduces. This results in retention of water and salt, increases the ECF volume to the normal. This in turn increases the blood pressure to the normal. Second, by simultaneously angiotensin 2 stimulate adrenal cortex to secrete aldosterone. This hormone increases the reabsorption of sodium from the renal tubules. Sodium reabsorption is followed by water reabsorption, resulting in increased ECF volume and blood volume. It increases the blood pressure back to the normal level. So, when there is a decrease in blood pressure, juxtaglomerular apparatus will be producing renin. So, angiotensin 1 converted to 2. So, there will be vasoconstriction. When there is increase in blood pressure, either by the increase in increasing in blood volume, there will be a reabsorb. The kidneys will be excreting more water and salt. So, thus by regulating means decreasing the blood pressure. Second question is describe stages of erythropoiesis and what are the factors regulating erythropoiesis, adenotron, iron deficiency, anemia. Stages of erythropoiesis. The first phase is pro-erythroblast or megaloblast. It is the first cell derived from the stem cell. It is large in size and nucleus occupies almost all cells completely. It multiplies several times and finally forms the cell of next stage called early normoblast. So second stage is early normoblast. Little smaller in nucleus, the nucleoli disappear and condensation of chromatin network occurs. This condensed network becomes dense. Third is intermediate normoblast. This cell is smaller than the earlier phase. Nucleus is still present, but chromatin network shows further condensation. Next is late normoblast. Diameter of the cell decreases further, nucleus becomes very small, quantity of hemoglobin increases and cytoplasm becomes almost acidophilic. The nucleus disintegrates and disappears. Reticulocyte, also called as immature RBC. Cytoplasm contains reticular network. The reticulum of reticulocyte stains with the supravital stain. The reticulocyte is a basophilic due to presence of remnants of Golgi apparatus, mitochondria and other organelles of cytoplasm. And lastly, mature erythrocyte. Reticular network disappears and a cell becomes matured RBC. Matured RBC is a biconcave and smaller in size. It is with hemoglobin and without nucleus. Factors essential for erythropoiesis and their role. First is the general factors. Erythropoietin is the most important factor. It promotes the production of pro-erythroblast from the stem cells in CFUE, the bone marrow. Development of pro-erythroblast into matured RBC through the normoblastic stages, early, intermediate and late normoblast and reticulocyte. Release of matured erythrocyte into the blood. Even some reticulocytes are released along with matured RBCs. Second is thyroxine. Being a general metabolic hormone, thyroxine accelerates the process of erythropoiesis at many levels. So, polycythemia is common in hyperthyroidism. Hemopoietic growth factor. These are the interleukins and stem cell factor. Generally, these factors induce proliferation of pluripotent stem cells. And the first one was general factors. Second is the vitamin. Vitamin B, its deficiency cause anemia and pellagra. Vitamin C, its deficiency cause anemia and scurvy. Vitamin D, its deficiency cause anemia and rickets. Vitamin E, its deficiency lead to anemia and malnutrition. Then the second factor are the maturation factors. The maturation factors, first one is vitamin B12. It is essential for maturation of erythrocytes. It is essential for synthesis of DNA. Its deficiency leads to failure of maturation of the cell and reduction in the cell division. Second is intrinsic factor of castor. It is produced by the gastric mucosa and is essential for absorption of vitamin B12 from the intestine into the blood. The third one is folic acid. It is required for synthesis of DNA. In the absence of folic acid, synthesis of DNA decreases and causing failure of maturation. And the third part of the same question was iron deficiency anemia. Iron deficiency anemia is the most common type of anemia. It develops due to inadequate availability of iron for hemoglobin synthesis. RBCs are microcytic and hypochromic. The causes of iron deficiency anemia includes blood loss, decreased intake of iron, poor absorption of iron from the intestine, and fourthly, by increased demand for the iron in conditions like growth and pregnancy. Features of iron deficiency anemia include features brittle nails, spoon-shaped nail, otherwise called Macular, bright brittle nail hair, atrophy or papilla in the tongue, and dysphagia, that means difficulty in swallowing. The third question, short notes, hemophilia. Hemophilia is a group of sex-linked inherited blood disorders characterized by prolonged clotting time. However, the bleeding time will be normal. Usually, it affects males with females being the carriers. Because of prolonged clotting time, even a mild trauma causes excess bleeding which leads to death. Damage of the skin while falling or extraction of tooth may cause excess bleeding for few weeks. Easy bruising and hemorrhage in muscles and joints are also common in this disease. The causes of hemophilia occurs due to lack of formation of prothrombin activator. That is why coagulation time is prolonged. The formation of prothrombin activator is affected due to deficiency of factor 8, 9 or 11. Types of anemia depending upon deficiency of the factor involved. Hemophilia classified into three types. The first one is hemophilia A or classic hemophilia. It is due to deficiency of factor 8. 85% of people with hemophilia are affected with hemophilia A. Second is hemophilia B or Christmas disease. It is due to deficiency of factor 9. 15% of people with hemophilia are affected by hemophilia B. The third type is hemophilia C or factor 11 deficiency due to the deficiency of factor 11. It is a very rare bleeding disorder. Symptoms of hemophilia include spontaneous bleeding, prolonged bleeding due to cuts, tooth extraction, surgery, hemorrhage in GI tract and urinary tract, bleeding in joints followed by swelling and pain, appearance of blood in urine. Treatment of hemophilia include the classical hemophilia include replacement of the missing clotting factor. The fourth question is juxtaglomerular apparatus. Juxtaglomerular apparatus is a specialized organ situated near the glomerulus of each nephron. The structure, it is formed by three different structures. First one is macular densa. Macular densa is the end portion of the thick ascending segment before it opens into distal convoluted tubule. It is situated between afferent and efferent arterioles of the same nephron. It is very close to the afferent arteriole. Second is extraglomerular mesangial cells. Extraglomerular mesangial cells are situated in the triangular region bound by the afferent arteriole and macula densa. These cells also are called agranular cells, Lassus cells or Gourmandin cells. Juxtaglomerular cells. Juxtaglomerular cells are specialized smooth muscles situated the wall of afferent arteriole just before it enters the Bowman's capsule. Functions. The primary function of the juxtaglomerular apparatus is secretion of hormones. It also regulates the glomerular blood flow and glomerular filtration rate. Secretion of hormone. They have secrete two hormones that the first one is renin and prostaglandin. Other substances like cytokines like interleukin-2 and tumor necrosis factor and macular densa secrete thromboxane A2. Regulation of glomerular blood flow and glomerular filtration rate is one of the function of the glomerular juxtaglomerular apparatus. Macular densa of juxtaglomerular apparatus plays an important role in feedback mechanism called tubuloglomerular feedback mechanism, which regulate blood flow in glomerular filtration rate. The fifth question is stages of deglutition. Deglutition or swallowing, the process which the food is passed from the mouth into the stomach. It occurs in three stages. First is oral stage. The food enters pharynx from the mouth. This is a voluntary phase. Second phase. In this phase, the bolus passes through pharynx to the esophagus. It is a voluntary or reflex in nature. Occurs in less than 2 seconds. Food that has reached esophagus from the oral cavity can have the four possible routes, that is back to mouth, nasopharynx, larynx and trachea down to esophagus. When the food is in the oropharynx, esophagus should be opened, other openings should be closed. Movement of food into the esophagus by upward movement of larynx pull up the enlarges the opening of esophagus, result in a wave traveling from superior to inferior constriction, thereby propelling food into the esophagus. The third phase is esophageal stage or third stage. The food enters the stomach to the esophagus. This is also involuntary. The movement of esophagus is specially organized for this function and movement is called peristaltic wave. By this movement, the content propelled down along the GIT. Diabetes insipidus. Diabetes insipidus is a posterior pituitary disorder characterized by excess excretion of water through urine. The main cause is due to deficiency of ADH, antidiuretic hormone, which occurs in the following conditions. First, the lesions or injury or degeneration of supraoptic and paraventricular nuclei of hypothalamus, lesion in hypothalamo-hypophyseal tract, atrophy of posterior pituitary, inability of renal tubules to give response to ADH hormone. Such condition is called nephrogenic diabetic insipidus. Signs and symptoms include polyuria, polydipsia and dehydration. Polyuria means increased excretion of large quantity of dilute urine with increased frequency is called as polyuria. Daily output of urine varies in between the absence of ADH. The epithelial cells of distal convoluted tubule in the nephron and the collecting duct of the kidney become impermeable to water. So water is not reabsorbed from the renal tubule and collecting duct, leading to loss of water. Polydipsia. Intake of excess water is called as polydipsia. Because of polyuria, lot of water is lost from the body. It stimulates the first center of hypothalamus, resulting in intake of large quantity of water. Third is dehydration. In some cases, the third center of the hypothalamus is also affected by lesion. Water intake decreases in these patients and loss of water to the urine is not compensated, so dehydration develops, which may lead to death. The seventh question is surfactant. Surfactant is a substance, acting material or agent that is responsible for lowering the surface tension of a fluid. Surfactant that lines the epithelium, the alveoli in the lungs, is called pulmonary surfactant, and it decreases surface tension in the alveolar membrane. The sources: type 2 alveolar epithelial cells of lungs, which is called surfactant secreting alveolar cells. The characteristic feature of these cells is the presence of microvilli on the alveolar surface. Then Clara cells which divided in the bronchioles. These cells are also called bronchiolar exocrine endocrine cells. Initially, the surfactant produced in the form of precursor material called tubular myelin. It is a membrane-bound organelle containing immature surfactant. After the formation, it is released into the alveolar lumen by exocytosis. The tubular myelin is converted into mature form of surfactant called monolayer of phospholipid film. Later, it spread over the entire surface of alveoli. The main functions include it reduces the surface tension in the alveoli of lungs and preventing collapsing tendency of lungs. The surfactant is responsible for stabilization of alveoli, which is necessary to withstand the collapsing tendency. It plays an important role in inflation of lungs after birth. It plays a role in defense within the lung against infection and inflammation. The eighth question is functions of middle ear. Middle ear is an air-filled chamber which consists of auditory ossicles, auditory muscles, and eustachian tube. Auditory ossicles are three miniature bones like incus, stapes, and malleus. Auditory muscles are the two skeletal attached to the ossicles. Tensor tympani muscles pulls and keeps the tympanic membrane stretched or tensed constantly. This constant stretching of tympanic membrane is essential for transmission of sound waves, which may reach any part of the tympanic membrane. Paralysis of tensor tympani causes hearing impairment. Then stapes. Tensor tympani muscle pulls and keeps the and third one is eustachian tube. Eustachian tube connects the middle ear with posterior part of nose and forms the passage of air between middle ear and atmosphere. So the pressure on both sides of tympanic membranes are equalized. Cell-mediated immunity. Cell-mediated immunity is defined as immunity developed by the immune response. It is also called cellular immunity or T-cell immunity. It involves several types of cells: T lymphocyte, macrophages, natural killer cells. Hence, the name is cell-mediated immunity. Cell-mediated immunity does not involve antibodies. It is the major defense mechanism against infections by viruses, fungi, and few bacteria like tubercle bacillus. It is also responsible for delayed allergic reaction and rejection of transplanted tissue. Cell-mediated immunity is offered by T lymphocytes and starts developing when T cells come in contact with antigens. The type of antigen presenting are macrophages, dendritic cells, and B lymphocytes. The macrophages are large phagocytic cells. The dendritic cells are the dendritic cells of spleen which trap antigen in the blood, follicular dendritic cells in the lymph node which trap antigen in the lymph, Langerhans dendritic cells in the skin which trap microorganisms coming in contact with body surface. And thirdly, by B lymphocyte. Recently, it is found that B lymphocytes also act as an antigen-presenting cells. Thus, these cells function both antigen-presenting cells and antigen-receiving cells. The 10th question, mean arterial pressure. It is the average pressure existing in the arteries. It is not the arithmetic mean of systolic and diastolic pressure. It is the diastolic pressure plus one-third of the pulse pressure. To determine the mean arterial pressure, diastolic pressure is considered than systolic pressure. It is because diastolic period of the cardiac cycle is longer than the systolic period. The normal mean arterial pressure is 93 mm of Hg. That means 80, that is the systolic. So the diastolic pressure and one-third of the systolic pressure, that is 13. So it is considered as a 9. One-third of the pulse pressure, not systolic pressure. It is a diastolic pressure 80 and one-third. Pulse pressure is normally it is 40. So one-third of the 40 is 13. So 80 plus 13 it is 93. Sickle cell anemia. Sickle cell anemia is an inherited blood disorder characterized by sickle-shaped red blood cell. It's also called hemoglobin SS disease or sickle cell disease. It is common in people of African origin. Sickle cell anemia is due to abnormal hemoglobin called hemoglobin S, that is sickle cell hemoglobin. In this, alpha chains are normal but beta chains are abnormal. The molecules of hemoglobin S polymerize into long chains and precipitate inside the cell. Because of this, RBCs attain sickle or the crescent shape and become more fragile, leading to hemolysis. Sickle cell anemia occurs when a person inherits two abnormal genes, that is, one from each parent. In children, hemolyzed sickle cell aggregate and block the blood vessels, leading to infraction, and the infraction is common in small bones. Infracted small bones in hand and foot resulting varying length in the digit. In this condition known as hand and foot syndrome. Jaundice also occur in these children. The third question is ovulation. Ovulation is the process by which the Graafian follicle ruptures with consequent discharge of ovum into the abdominal cavity. It is influenced by the LH hormone, occurs in the 14th day of menstrual cycle. In a normal cycle of 28 days, the ovum enters the fallopian tube. The process of ovulation mechanism is not known clearly. The stages are rupture of Graafian follicle fluid. The follicular fluid oozes out. Germ hillock is freed from the wall. Ovum is expelled into the abdominal cavity along with some amount of fluid and granulosa cells. From the abdominal cavity, the ovum enters the fallopian tube through the fibrinated edge. Renal threshold. Renal threshold is the concentration of a substance dissolved in the blood above which the kidney begin to remove it from the urine. When renal threshold of a substance is exceeded, the reabsorption of the substance by the proximal convoluted tubule is incomplete. Consequently, the part of substance will remain in the urine. Renal threshold vary by substance. Low potency poison urea, for instance, is removed at much lower concentration than glucose. Indeed, most common reason for the glucose renal threshold ever being exceeding is diabetes, which is known as glycosuria. Renal thresholds can also be altered by many drugs and may change in characteristic way during certain illness also. Myopia. Myopia is the eye defect characterized by inability to see the distant object. Otherwise also known as short-sightedness, because a person can see near object clearly but not the distant object. In myopia, the refractive power of lens is usually normal, but the anteroposterior diameter of the eyeball is abnormally long. Therefore, the image is brought to focus a little in front of the retina. Light rays, after coming to a focus, disperse again, so a blurred image is formed upon the retina. The myopic eye is corrected by using biconcave lens. The light rays are diverged by the concave lens before entering the eye. Functions of oxytocin. Action females. The main action on mammary glands and uterus. On mammary glands, it causes the ejection of milk from the mammary ducts of the mammary gland lined by myoepithelial cell. It squeezes the milk from the alveoli of the mammary gland to exterior through the duct system and nipple. On pregnant uterus, it causes contraction of uterus and helps with the expulsion of fetus. Non-pregnant uterus, the action of non-pregnant uterus is facilitate the transport of sperms through the female genital tract to the fallopian tube by producing uterine contraction during sexual intercourse. Action on males. In male, release of oxytocin increase during the ejaculation. It facilitates release of sperm in the urethra and by causing contraction of smooth muscle fibers in reproductive tract, particularly vas deferens. Tidal volume. Tidal volume is the volume of air breathed in and out of the lungs in a single normal quiet respiration. Normal value is 500 ml. Tidal volume signifies the normal depth of breathing. Intrinsic factor. Intrinsic factor of gas secreted by gastric plays an important role in erythropoiesis, necessary for the absorption of vitamin B12, which is called as extrinsic factor from GI tract into the blood. Vitamin B12 is an important maturation factor during erythropoiesis. Absence of intrinsic factor, gastric juice causes deficiency of vitamin B12 leading to pernicious anemia. Cretinism. Cretinism is a hypothyroidism in children characterized by stunt growth. Cause of cretinism are due to congenital absence of thyroid gland, genetic disorder, or lack of iodine in the diet. Features of cretinism include a newborn baby with thyroid deficiency may appear normal at the time of birth because thyroxine might have been supplied from the mother. But a few weeks after birth, babies start developing signs like sluggish movements and cracking sound while crying. Unless treated immediately, baby will mentally retard permanently. The skeletal growth is more affected than the soft tissues, so there is a stunt growth with a bloated body. The tongue becomes so big that it hangs down with a dripping of saliva. The big tongue obstructs swallowing and breathing also. Refractory period. Refractory period is the period at which muscle does not show any response to a stimulus. It is because of already one action is in progress in the muscle during the period. The muscle is unexcitable to further stimulation until it repolarizes. It is of two types. One is absolute refractory period. It is the period during which the muscle does not show any response at all, whatever may be the strength of the stimulus. Relative refractory period is the period during which the muscle shows some response if the strength of stimulus is increased to the maximum. Thank you. Thank you for listening.